Hello everybody, my name is Ashraf Mohammed. I'm first year registrar of Feminist registrar of CMH. Today I'm going to be talking about my working research proposal. So it is known for the term, the title is Determining the Levels of Health Literacy Among Adult Hypertensive Patients while Assessing Hypertension Treatment Targets in Mthatha, Eastern Cape. So health literacy is defined as the personal characteristics and social resources needed for individuals and communities to access, understand, appraise, and use information and services to make decisions about health. This is a new term that's been it's revised in 2015 by the World Health Organization, and it just looks at people's understanding of how to gain literacy of health and what they use to incorporate, getting better health. So the second slide is my research question. Does health literacy level play a role in achieving blood pressure targets in adult hypertensive patients in Mthatha? So the study aims to assess the health literacy level in individuals with hypertension in Mthatha, South Africa. In addition, the study will examine the association between health literacy level and blood pressure treatment target in this population. Before I go on to the research objectives, I'd just like to say that my interest is in understanding health literacy, and I moved on to the hypertension because we have something to look at targets. So there is one factor that we can look at if the people are achieving their targets. And I also came across a validated questionnaire in South Africa that's not just based on the literacy of people, but also the health literacy in the sense that it's not just based on reading and writing skills, it's based on how they understand knowledge. So I do have a validated questionnaire for a hypertension health literacy. Now, the research objectives are, number one, to determine the health literacy level in adult patients with hypertension. And number two, to assess the treatment to target blood pressure in this cohort. And finally, number three is to examine the association between the levels of health literacy and blood pressure treatment to target. Thank you.
So Ashraf, can you say a bit about, I got a couple of questions. Well, first of all, let me start. Do you have any specific questions for me before I turn questions to you?
So the study type design is going to be a cross-sectional analytics. And I had come to a crossroads between, do I do the questionnaire just to health literacy and just use that validated questionnaire for that? Or do I do a hypertension health literacy questionnaire and go down this hypertension? Because it was posed to me the last time by the group, the professors, they were asking me, why is it hypertension? Why is it not just health literacy altogether?
So to answer your question, let's start with the research objective number 3. I'm going to read what you have. To examine the association between. If you start right there, if you stop right there, that suggests that whatever information you collect from folks in Mthatha needs to have information about health literacy and about blood pressure treatment. In addition to the things that we talked about in the first segment, you need to collect as much information as you can on possible confounders, right? So if you're going to do this survey, then the survey needs to have information with regard to ways that you will measure the independent variable and ways that you will measure the dependent variable. Then you need to know enough about the literature to know, to say something about how you'll measure all the confounding factors. So the confounding factors or the potential variables need to be in the questionnaire that you will collect. that you'll distribute them, sorry. Right, so that was the long answer. The short answer is it needs to have both. I would suggest that it have both.
Health literacy and hypertension.
Yes, yes, exactly. So you need information about both. My question to you is a couple of questions. Do you have any ways in mind? I'm going to use a technical term here for. There's a feedback. Yeah. Do you have any ways in mind for how you're going to operationalize? Right. When I say operationalize, how will you actually technically measure health literacy, and how will you technically measure blood pressure treatment? Right. So yeah. So it's well. I think it's well formulated conceptually here in terms of the question, but things that you'll have to figure out is, well, how will I actually measure these things using, of course, information from the questionnaire.
Thank you for the question. So I have the validated questionnaire. There's two questionnaires. One is a 3-question tool from the World Health Organization just for health literacy, and the other one is about 5 to 7 questionnaire for a validated South African hypertension health literacy tool. The way we'll be doing blood pressure checks will just be on the calibrated blood pressure machine that is, a validated tool in our setting, and the target will be as according to the South African guidelines with the target blood pressure. The inclusion of the study will be people who have been on blood pressure medication, adults who have been on blood pressure medication for at least 6 months or longer, so they've had enough time to get onto target. Thank you.
You're welcome. Yeah, just keep in mind that my comments about the confounders, right? You need to know enough about the literature to know what those confounders are and how to collect them. How to collect them. Yes. So that's probably the next step, right? So in other words, you'll need more than like 3 questions or 5 questions. You'll need information, other types of information from these folks. And I have, I don't know the literature well enough to know what those confounders should be, but I'm sure you got that covered. Next person. Thank you. Thank you so much. Was that helpful? Hopefully my comments are helpful. Wonderful.
Sharing my slides, Madeleine here. Hi, yes, I feel like I've hate crashed the registrar training, but our old dogs can't remember any of this stuff anymore. So thank you very much. I think it's very useful for both juniors and seniors. And I'm actually busy with a study at the moment for the Colleges of Medicine of South Africa. Mthatha has been helping me with this. But I feel I am a convener of the diploma, so I have a very good knowledge of this diploma, but I don't have very good knowledge of research methodology, which is where I've been struggling with it. So this is all the official stuff out of the protocol that we submitted for ethics submission, which is where we're at the moment, and we have sent out the surveys. We're doing our study through doing a cross-sectional survey, and it has to do with how candidates perceive the benefits and challenges of the new curriculum that we've been using with the diploma in HLE management. So that's our overall aim, is to look at the value of this revised curriculum and the guided learning study program. So I'm not going to worry about all the objectives because I only have, my question is actually to do with all 4 objectives. So I've just highlighted the one there. So what we've been doing with the diploma is we've arranged a 9-week study program. So in the past, when people wrote the diploma, they studied at home, they got no other support except a list of resources, a list of topics, and then they would come and write the exams. So we've now created 27, we've structured a curriculum in a very specific way. And we've now created a 9-week study program that progressively takes them through that curriculum, which at the moment is just emails we're sending out. So we have no idea if people are actually using the study materials we are sending out and how useful they are finding it. So that is what I'm looking for.
Yes.
So this particular one is to look at the utilization.
Yeah.
How often do they use it? And then the perceived benefits. And this is where the sampling question comes up. And I just want to follow up that this morning was quite useful. So it is a mixed methods design. There will be place as well to give qualitative input. And I'm not too worried about, I feel actually more confident on crunching the qualitative data. And for me, it's more the quantitative part of the survey. So we have questions in the survey of how often have you used the weekly study materials, very often, not often at all or whatever, using the Likert, thank you, American accent scale. And then we will also have questions on how useful they found that actually for the preparation for the exam. So this is where this is what we've written in the protocol, and Dr. May helped me with this, but I need to get my own weight around understanding, and I'll just repeat what we discussed this morning around the fact that the sampling here is complicated because it's not random. We have roughly, let's say, 545 candidates that we are sending this particular survey, and I'm dependent on their goodwill to fill in the survey and return it. Mm-hmm. So with busy doctors, this is always a challenge. And these are all the doctors that wrote the exam in the last year and a half, which is when we've been having this program. So the question is that in terms of me being able to now I've got the surveys back, I've already got 150 at the moment. When I write my article, my conclusions, if I now look up and say, I'll be able to get percentages of how so many people actually use the material, so many people actually said they found it useful. What do I do with that data in terms of reporting it? And this is where we have this discussion around sample size. So as I understand this morning, Prof Tawi was saying in this kind of scenario, because it's not randomized, it has to do with rate of return, which is a different concept than sampling. And the rate of return needs to be very high. I think that's this 95%. Confidence interval? No, I don't know. I'm not confident on this.
No, it's fine.
Okay, great. But this is my question, is basically I need to know at which point can I make inferences for the whole group.
Okay, so a couple of things. It seems that the population is 545.
Yeah.
Right? Second, you said that you want to make inferences to that 545.
Well, that would be always the ideal. If I'm not able to, I need to be clear what.
Okay, so one of the things that you could do is you could define the population, and you could, if you really are interested in making inferences, then you just use the convenience sample, which is the convenience sample basically is how convenient is it? Another way to think about this is that you're only getting people into the sample for whom it was convenient to fill out the information. You've already done that, right? So you've got your 150 that satisfies the criteria for that convenient sample, okay? What you want to do is stay away from hamstringing or tying your hands with respect to trying to approach randomization of a sample to the 545 population. You're never going to meet that standard, right? So I would advise you to let that part go. Admit to yourself that the best thing that you can do is to rely on a convenience sample. As I was writing on what you said, you've got about 150, right? Yeah, I mean, that's actually pretty good for a convenience sample, right? So it's already there if you want to rely on your rely on a convenience sample. You could always do more, but it's just that you're going to be making less strong inferences from that convenience sample to the population. Less strong inferences. right? So basically you will be making inferences to the population of people that are able to respond to your survey, or that actually filled out the responses. But this is really about cutting your losses, so to speak. You're never going to reach the high standard of randomization. So you have to live with that and say, all right, the next standard is that I'm doing a convenience sample. And now, at what point is enough for my convenience sample?
No, that's very helpful. It's also made me realize it will depend a bit on the indicators. So the utilization indicator, like how many people actually signed up for the course and used the materials, that's going to be skewed.
Yes.
Because the kind of people who reply on the survey are probably more likely the kind of people who will also use materials.
Yes.
But in terms of the people who use the materials, how useful they found that materials, that's probably less skewed by a convenience sampling, because that has to do out of 150 people who actually then, so many looked at the materials, how many of them found the materials useful for the preparation of the exam. That's really quite a good number.
Exactly.
To make that kind of, you said more than 30 already gives you a fairly good idea.
Yeah, I mean,
in terms of, okay, there's more than 30 people taught this, so it might be.
Yeah, I mean, I
reliable data.
Yeah, I think you're already a long way there, right? So if you're willing to cut your losses with regard to randomization, then I think you're in good shape.
Thank you very much. That's great. That's it for me.
Wonderful. Thank you. Ah, this was easy. Who's next? So you sent me email and I just have to pull it up.
Has it left the building?
Yeah, it's still updating my inbox. It's coming. There it is.
Yeah.
I got you.
Very impressed with your finances.
Oh, thank you. All right, we're in business.
Okay, we just need to share that. Hold on, let's just go to Zoom.
All right. Yeah, so I'm going to be looking at my proposed research for the MA is traditional health practitioners in childhood health in rural areas. So I'll just start with my aim. This research aims to further describe the role of traditional health practitioners in the primary health care of children. My question is, what is the prevalence of traditional health practitioner consultations among caregivers of ill children before seeking care from government health facilities, and which are the leading determinants influencing the health-seeking pathways of caregivers in the rural industrial sub-district of the Eastern Cape? Should I go through my objectives?
Yeah, go ahead. Go ahead.
My research objectives is determine the prevalence of traditional health practitioner consultations prior to consulting government health facilities for the presenting condition that led to hospital admission. In the month prior to admission, determine the number of consults with the traditional health practitioner. 3, quantify the leading factors influencing the caregiver's decision to consult a traditional health practitioner prior to seeking care from the government health facility. And 4, predict the likelihood of a child receiving pluralistic care that is concurrent use of traditional and modern medicine. Yeah, I think the reason for me doing this is we've just seen how it feels like it's quite a prevalent occurrence to have a child come into our casualty and they had seen a traditional health practitioner before coming to us. But from my literature review that I did, I could not find any quantitative studies on this topic in our area.
So, question, are there qualitative studies that do this?
There are plenty of qualitative
Okay.
studies regarding looking at why people choose to go to traditional health practitioners instead of government health facilities, but the actual prevalence of these consultations.
Sure. All right, so I'm really excited about this project, but before you move on, do you have any specific questions? And I've got a couple.
I think I appreciate all your comments. But again, it's maybe not in your area of expertise, but it's just about validating questionnaires or like my survey that I was going to do, and then just again my sample size calculation.
Okay.
The expected prevalence.
Just a side question on the way, your population and therefore the people visiting, the ill patients who have visited your hospital, you're not going to the community.
I'm using them as the children admitted to my hospital.
You're starting with the children admitted to your hospital and working that business.
Requiring medical care in the induction site.
So you want to know how many of those you need to sample to make inferences for the whole population of ill children.
Okay, a number of things. Let's start with big concept issues. So in terms of how you would frame this, right? One of the best ways I've seen that this work is done, especially work where there is a dearth of quantitative information that describes a phenomenon or describes the prevalence of something going on. Start with the qualitative evidence. This comment is really about building the case for what you're doing, which I think you've already done in your own head. But you start with the qualitative evidence, right? And that opens the door for saying, look, there's all of this qualitative evidence out there, but at a starting point, we just don't know anything quantitatively about the degree to which this is actually going on in terms of quantifiable numbers, right? So I would start there, primarily because before you get to asking questions about prediction or anything like that, the medical community needs actual evidence about how often this thing is happening, right? And I think young students tend to overlook the elegant simplicity of that kind of framework. So I think that before you think about making any kind of predictions or predictive modeling, I think that it's really important for you to step back and understand the importance of simply documenting the prevalence of this thing. That's actually something that's groundbreaking, right? Because it's never been done before. Second point about that, in terms of having an impact on the field and publishing this work, there is no pathway to publishing that is easier than putting something in the literature in terms of like just descriptive evidence if it has never been done before, but the qualitative evidence points to it, right? So if you can just simply gather information on how often this is happening, then any kind of statistics that you, any kind of modeling that you do after that is simply gravy. It's simply over and above what you actually need to do to make a stamp on the literature, right? So that's like some encouraging kind of words for what you're doing. I'm very impressed. Let me say a bit about this business of sampling and populations, right? So remember, when we use samples, we are actually using samples to make inferences on populations that tend to be well defined. If your population has not been well defined, then you would be wise to start there in terms of just gathering data define what the population is, right? Once that's defined, then that's the thing to which you make the inference from the sample, right? But this is a way of saying I don't want you to put the cart before the horse. Define the population first carefully, right? Once you define the population, what you will find is that, like you suspected, there is no real information describing anything about this population, right? So you collect as much population information as you can once you've defined it conceptually. Collect as much population information as you can, and just do descriptive statistics on that, right? That would be good enough because we don't know very much about this topic, right? So when I talk about putting the cart before the horse, you remember most of the techniques we talked about at the beginning of today's seminar rely on this concept of making inferences from samples to population. But doing so really relies on having a well-defined population, right? That's not something that you have, and that presents a golden opportunity for you, right? So I would take a step back and ask myself, first of all, do I have a handle on what the population is? And if I don't, you'll find that you don't. But when you do, concentrate on collecting as much information about that population as possible to simply describe the contours of the population. That in and of itself is groundbreaking. I don't know if Prof. Tawe, what do you think about that? My comments.
Yeah.
I've got a comment.
So the thing I'm trying to get my head around is actually when you're talking about the population, we are talking about ill children who end up in hospital, which is actually a population you have a lot of control about. So you're not trying to identify, how often do parents sick go to traditional healers with their children.
Yes.
You want to know with ill children who end up in hospital, how many of that population. So that's the population that you're actually describing. And then if you want to then look at the prevalence of that population, so if you want to get a sample of, if your population contours is all the ill children that gets admitted to hospital, surely you will have data over the last year of how many ill children get submitted to hospital, right? Wouldn't that give you actually a sample size in terms of your population to be able to describe the whole of the ill population?
Is that your population?
So the population, I mean, ideally, I would love to go out and use them for every child, but cost and time. So I needed to find a smaller population. So I'm looking at ill children that require care. And as we are the only facility with pediatric ward in the area, I feel like it's a good sample of the ill population, children that are admitted to our hospital with the area population.
Okay, so your argument is that the actual population, ill children who require care or who are admitted to hospital because they require care, that's the population, right?
Yes, but I also understand that there are ill children in the community that only go to traditional care and don't go to any government hospital. So I understand a lot of or they go to the clinic, but I'm more looking at those children that are really that sick that actually do need to come to hospital. But I'm not looking at the outcomes of the traditional healer consult.
Just looking at the behavior of the behavior itself.
Right. JD.
I mean, like you said, it's not about the story you tell. So as long as you can what David always tells me is as long as you can justify to them why you are things like that. And I guess the angle that you're taking can become, because we know that there are many kids who get sick at home and don't come to hospital. So it's not only the sick population. We often just see the typical aspects of things. But your story can also be the story of co-care of these people who seek care from government substantially. Does that, I mean, there could be an angle to try and describe the computation.
All right, so in terms of piggybacking off of what JD was saying, once you, it's easier to determine issues of sampling if you have a well-defined population, right? The larger and the more well-defined the population, the easier the sampling. All right, so your first step is to define the population appropriately in your own head, right? Once you've done that, then you go through the steps that we talked about today in terms of determining the kind of sample you need and the size of that sample, right? But I think there's a bit of conceptual work to be done before you get to that point. Defining the sample is, I'm sorry, defining the population is always harder than you might think, right? But once you've done that, once it's clear in your own head, then you know what kind of sample you need. Make sense? Who is next? You did? All right.